market at BB, subsequently the Bakau Craft Market, and latterly the new Birkama Craft Market were also built. The significant achievement demonstrates the commitment of government to enhancing the role of craft markets in the promotion and development of tourism and its contribution to the socio-economic well-being of Gambians.
She implored members of the Federation to better prepare for the winter season with a new slogan she called "No Hustle, No Harassment." Officially launching the Federation, the Vice President and Minister of Women's Affairs, Dr. Aja Aissatou said he lauded the initiative of establishing a federation, noting that in unity lies strength. She sought government's commitment to continue providing the enabling environment for all stakeholders in the industry, including the craft market vendors, to operate productively to the development of the country.
The tourism industry is undergoing, as I said earlier on, a very critical phase, characterized by certain turbulence. We all know at the global level what is happening. Everything is going down in terms of economic, financial crisis, and is reflecting in tourism as well. You have a lot of hotels in Europe and elsewhere with nobody occupying them. So it's not only in Africa that we may face that problem, but I'm telling you that throughout the world, tourism is one of those industries that is undergoing a crisis. Thus the need for us all to be innovative and forward-looking and competitive as well. That surely cannot be overemphasized.
Officials believe the contribution of the informal sector, such as the craft markets, to the sustainability and development of the tourism sector remains an integral part of the tourism policy. However, the Craft Market Federation is expected to work closely with the tourism industry through the Gambia Tourism Board to examine issues surrounding the operation of the markets, including product innovation and refraining to meet customer care and satisfaction and adhere to regulatory mechanisms. The Federation is also expected to serve as a mouthpiece to the association. Mama J, GRTS.
Broadcasters at the radio arm of the Gambia Radio and Television Services have commenced a 2-week in-house training program. The course curriculum is designed to arm participants with skills and techniques capable of improving the quality of programs produced by the radio. Samuel Barr tells us more.
This is the latest batch to benefit from a 2-week-long training program as part of efforts by the management of the state broadcaster to enhance the capacities of its staff. It is no secret that the broadcasting industry the world over is rapidly evolving, and thus the need to keep abreast with budding challenges and dynamics of the fast-growing industry. The training will thus focus on key areas deemed pertinent for broadcasters, such as program formatting, radio program production methods, as well as the essential techniques of local language translation, among a host of other areas.
In the coming 2 weeks, we will try as much as we can to introduce you to the basics of radio program production techniques and some of the things that it would take to make a good program.
Officials were unequivocal in their words about the impact the training could inject in the institution's service delivery.
Since broadcasting is a specialized area, as mentioned by the Director of Radio Programs, the most valuable assets, we will also agree that the most valuable assets of an institution is its human resource base. Therefore, GRTS places a high premium on training.
Training is essential, but is only important when it is put into good use.
For the Deputy Director General of GRTS, capacity building is something his institution remains committed to. It is the most recent training for radio broadcasters as part of efforts by the GRTS administration in further enhancing the capacities of staff. Samuel Ba, GRTS.
The monitoring and evaluation mechanism for the enforcement of legislations on universal salt iodization and iodine deficiency disorders in the Gambia is the subject of a 2-day training for journalists drawn from the print and electronic media. Modulamin Sise reports the program organized by the National Nutrition Agency in conjunction with the UN Children's Agency is expected to strengthen the IEC component of the battle against iodine deficiency at national level.
Case of battling iodine deficiency disorders in the Gambia, only 23% of the population, according to the last survey in 1999, consumes iodized salt. This means 77% of Gambians by the same token are at risk of suffering from iodine deficiency disorders. To improve the statistics, the National Nutrition Agency in partnership with UNICEF now hinges on the gentlemen of the press for increased awareness on iodine deficiencies and the challenges it poses to public health.
To ensure that whilst NANA and government provide the necessary environment, you also play your role to ensure that that information is shared with families. This, put simply, is the purpose of this workshop. To prepare you to be able to share information with communities so that eventually they get to utilize iodized salt.
John Egbota is the program coordinator of the International Council for the Control of Iodine Deficiency Disorders in Western Central Africa. According to him, the importance of the media in the fight against iodine deficiency is crucial.
In the state, we have the executive, we have the legislature, we have the judiciary, three of them. But there is a fourth angle to it, and that's the media. Those that will tell the rest of us what is happening around. So it is good that you are here to be part of this workshop, to be trained and to be informed as to what we mean by a lack of iodine in the system.
In the Gambia, there is a legislation that outlaws the sale of salt that is not iodized, but the implementation of the law is what has stalled. Journalists, however, NANA officials believe can help increase awareness of the existence of the legislation in order to improve public health. For the consequences of iodine deficiency disorders are costly.
We don't want to have idiots in this country tomorrow. In this country, our most important natural resource is the human stock, the human capital. So therefore, we must lay a strong foundation in that human capital by ensuring that iodine is available at every nook and crook of this country, so that every child, every pregnant woman can benefit from the consumption of iodine, particularly through salt.
Required in very small quantity in the body, the lack of iodine comes with serious consequences. Cretinism, goiter, and infections before, during, and after pregnancy are some of the disorders. Pregnant women and children are the most vulnerable. While it makes pregnant women suffer from goiter, it results in brain damage and mental retardation in children. Such disorders endanger the achievements of some of the MDG goals which seek to improve infant and maternal health. Although NANA has been conducting iodization activities for major salt production sites, the remaining pockets that exist across the country need awareness to push them into action. That challenge is placed on the shoulders of workshop participants who feel they can make an impact.
To go back to our various newspapers or radio station or TV, try to sensitize the local people, especially the local people who are relying on us to give them information relating to these iodized deficiencies.
Illiteracy is a cankerworm within our society. Most of the people in the Gambia are not educated, you understand. But now, with the coming of the government, though the government is trying, well, despite the government is trying, we who are working within the media outlets, it is our duty that when we return to our various places to sensitize people, to organize radio programs, so that people can know that the salt that they consume should be adequately iodized.
Sensitizing the community, I think, using the community radio station will bring an impact, and it will bring additional change to the entire community.
Preventable though, iodine deficiency disorders are the most prevalent non-infectious diseases globally, affecting 655 million people. And in the Gambia, where only 23% consume iodized salt, the battle is even bigger. Modulamin Sise, Grts News.
Well, you can also follow that story and other GRTS programs live on www.grts.gm. There you can also monitor GRTS Radio live. Time now to take our first break. When we come back, we'll take a look at news from outside the Gambia.
What's your AfriCell number?
773.
What's your mobile number?
735.
What's your AfriCell number?
746.
What's your number?
My number is 215. 2?
You mean 72?
No, it's 2, and I am AfriCell too. AfriCell.